In 2015, I was pregnant and I gave birth in November. My son was diagnosed with severe neonatal jaundice. But because I was a first-time mom, I could not identify the signs of jaundice. Can we all hear me? Yes. So because I was a first-time mom, I could not identify the signs and the symptoms of neonatal jaundice. I mean, I heard people passively talk about yellow eyes, but it had nothing to do with me having my baby and my baby having, jaundice, and that was why his eyes were yellow. I couldn't connect it. But anyway, I think we got to the hospital a bit late because at that time, the doctors were already panicking. And even though the doctors were panicking, there was no phototherapy unit for my son. So for a couple of hours, I was pacing around the corridor. I was crying. I mean, it was just barely 48 hours after I gave birth to my son. So I could still feel the pain of childbirth. So I was limping and I was crying. And I was hoping that my son would be well. A few months later, I came up with the idea of providing effective phototherapy units for babies, regardless of where they are. In the urban cities, in the rural areas, every single baby in Nigeria and in Africa. And that's how we came up with the Cerebral. It was called the Greenhouse Phototherapy Unit before, but then it sounded like an agricultural project or something. So as the idea continued to grow, I'm not a doctor. I'm not a science student. I don't work in the health sector. I've never worked in the health sector before this time, but I was able to share the vision with a few doctors, other mothers who could help to send the message across to other people who became ambassadors for change in the maternal and child health space. And they spread the message. And while I grabbed the vision to save babies from neonatal jaundice and, possible consequences of not treating the health condition, consequences like blindness, hearing loss, mental retardation, or cerebral palsy, or death in the worst case scenario. Now, I've met a couple of children with cerebral palsy and who have other complications from untreated jaundice. The problem is jaundice is a very simple health condition to treat. However, accessing phototherapy units is difficult. In hospitals, everywhere. In a lot of hospitals, you would see the conventional phototherapy devices. They have a stand, something like this, but it's heavier. It's bulky. It has fluorescent lights up there. If you've seen it, some of us who have children here may have encountered situations like that because jaundice is very common. And it's, over 30 to 40% of people who report back to the hospital for immunization are kept back because their babies have jaundice or they've identified jaundice in those babies. So coming up with the Cerebral phototherapy unit, you can see them setting it up. It's very easy. Anywhere there's a jaundice baby, you just pick it up and take it there to them. But the problem is a lot of mothers have not known or, been able to identify jaundice signs and symptoms in their babies and to do all these things. So what Tiny Hearts does is, first, we educate the mothers on how to identify signs and symptoms of neonatal jaundice in their babies, and then secondly, how to or where to go to find treatment. First, they can call us or they can get to the hospital. The bottom line is to make it accessible to them. And we've embarked on several projects like the Yellow Alert Project, which is basically sensitizing these women in hospitals, in rural areas, in so many places. And we partner with individuals, organizations to make it bigger. Partnership is what has made us big. Because for me, who has never worked in the health sector before this experience, going into a place that I was new to, I had a lot of people doubt this project. I've been literally thrown out of a room filled with medical doctors and nurses who thought, you're an artist, what are you doing with a medical device? It's not going to work. We're not even going to test it because the best we can do for you is put the blood of a rat inside it, not even the rat itself. Anyway, those are the kind of challenges we faced at the beginning. But then, the past 4 years has been growth and challenges, beating one challenge and jumping up to the next milestone. And that's how we have thrived, collaborating with one organization, getting support from different people. I would say that many hospitals would right now, they even prefer the Cerebral phototherapy units to the ones that are imported into Nigeria. And this is because we have emphasized on the problems, we have made sure that we emphasize on the problems that mothers face while trying to find treatment for jaundice, and then turning those challenges into solutions for babies in Nigeria. So this is how the Cerebral unit works. Let me wear the net for you. Apart from just having the Cerebral unit, a lot of babies always have malaria when they're treating them for jaundice because the unit is open and the baby is inside. Mosquitoes come in and just bite the baby at will. And when the baby is cured from jaundice, the baby eventually has malaria. And then they start the treatment all over again. Let's treat baby for malaria. And that's a newborn baby. I should tell you that my son is fine, eventually. And one of the things that in fact, 3 of the things we encountered was that he had skin burn. His skin started peeling seriously when he came out of the Cerebral unit. He was constantly febrile. That's his temperature was also always very high. And when you can't control the temperature of a baby, a lot of times, it could cause other complications from dehydration to other things. So it was us fighting a lot of battles just because we wanted to treat a condition as simple as neonatal jaundice. So here's how it works. First, the light temperature, definitely. It's not as hot as the problem we are trying to solve. And this is how we protect the babies from having malaria. You can just wear it underneath the other way around. Yeah. And whether a baby has rich parents or poor parents, they are able to access the Cerebral phototherapy unit. Whether they live in the urban city or in rural areas, we want them to be able to access phototherapy treatments. In Nigeria, there are so many homes where they cater for, apart from motherless babies like the orphanage you talked about. There are homes where they cater for children with cerebral palsy and a lot of other physical, a lot of other disabilities that children have. But there's no particular place where they try to prevent these things from happening. This is what Tiny Hearts technology is trying to do, trying to reduce the incidence of infant disabilities or morbidity or infant death. And now we are launching a new project called Cerebral Palsy Prevention Project. It means that if we are able to provide or deploy these Cerebral phototherapy units to your communities, not just communities of our choice, but even yours. If we are able to deploy more of these units to these places, it means that babies or children may not be exposed to conditions like cerebral palsy, hearing loss, blindness, deafness, mental retardation. Because if it continues like this, the future of work is at stake. Having a lot of children or people who are not mentally stable to be able to work and earn a living. It will affect even our economy, our lives. So as women and parents, we should, please connect to everything I have said. Connect to the Cerebral phototherapy unit and work with us for the Cerebral Palsy Prevention Project. Cerebral Palsy Day in the whole world is on the 6th of October, 2021. And on that day, we want to be proud to say we are deploying thousands of Cerebral phototherapy units to poor communities, even in urban cities, everywhere, just because we want to prevent cerebral palsy from happening. Thank you very much. My name is Cerebral.